Drugs never heal. They never heal. And I know with my mum, when she first started to get her pains in her hands, she went to the doctor who gave her some anti-inflammatories. And then as it got worse, then he put her on prednisones and cortisone.
I looked down and Taylor went purple. I mean, she was purple. It's just like she died in my arms. She just stopped breathing.
It turns out a nurse mistakenly gave Taylor an IV of morphine intended for her mother.
There should be no way that a very small IV line of a 4.5-pound baby should be confused with that of a full-grown woman.
Both your mothers did not want to give you those, but they didn't know what else to do. And I've been in that situation. So now I want to be that voice that says, you don't have to do this.
Yep.
So there's only one reason I'm glad for my explosion on the internet is that more will hear this, more will have my little handbook on natural remedies, and more mothers will be rescued from that horrible situation of, I don't want to give my child a, but I don't know what to do.
As of today, whenever you get sick, you go to a doctor or medicine practitioner. But what if I told you that the number of deaths occurring due to the errors and negligence of these MDs is the third largest in the USA? People are dying due to this, and we put our trust in doctors and medical workers because of their extensive training and skills. Despite our fair expectations, doctors and medical experts can make mistakes.
That medical errors kill 251,000 people every year, and that is more than respiratory diseases, accidents, and strokes. Medical professionals say it's more than having a bad doctor. The survey cites a number of systemic issues that can lead to the death of someone receiving medical care.
Surprisingly, these errors occur more frequently than expected, prompting a study that revealed medical errors as the third largest cause of death in the United States. In this video, we're going to reveal why patients are dying due to medical errors and what Dr. Sebi and Dr. Bobby Price suggest to avoid these circumstances. So stick to the end to never miss a thing, as it's a matter of life and death.
Medical errors, a leading cause of death in the United States. According to an article out of Johns Hopkins, medical errors account for 250,000 deaths per year. That would place medical errors third, just behind heart disease and cancer.
An investigation published in the BMJ, previously the British Medical Journal, discovered that medical errors kill 251,000 Americans per year. This ranks medical errors higher on the list of causes of mortality than accidents, strokes, respiratory disease, and Alzheimer's disease, with only heart disease and cancer accounting for more deaths. Medical errors include a variety of concerns, such as hospital system failures, communication breakdowns, inept clinicians, and drug medication errors. Inaccurate patient information or miscommunications across departments can also cause issues. The study, conducted by Martin Makary, a surgery professor at Johns Hopkins University School of Medicine, emphasizes the disturbing truth that many people die as a result of the care they receive rather than the problems for which they seek it. Medical blunders have been a source of concern for more than 2 decades. A 1999 Institute of Medicine report classified preventable medical errors as an epidemic, raising debate about how to manage and minimize them. According to the study's findings, medical errors cause around 700 deaths every day, or 9.5% of all deaths in the United States each year. Some experts feel the true figure could be higher due to flaws in how causes of death are reported. Currently, the United States Centers for Disease Control and Prevention, or CDC, does not require the reporting of deaths caused by medical errors using billing codes, which may result in underreporting.
The CDC classifies deaths based on billing codes, so medical errors and medical mistakes are omitted. Do you know a physician filling out a death certificate having classified a potential medical error as the cause of death? The CDC methodology directly affects research and funding, and so heart disease and cancer receive the lion's share.
Medical errors can occur in a variety of medical settings and positions, including doctors, anesthesiologists, and nursing staff. Common errors include prescription blunders, anesthetic errors, and surgical errors such as operating on the wrong part of the body, the wrong patient, or leaving a foreign item inside a patient. These surgical errors, known as never events, are behaviors that should never occur under the supervision of a qualified medical physician. Unfortunately, such occurrences do occur, resulting in serious implications for people. The findings of Martin Macary's study highlight the critical need for reforms to guarantee patients receive safe and effective care. Addressing the underlying causes of medical errors while taking preventative measures could save countless lives each year, rebuilding faith in the healthcare system and improving outcomes for patients. Well, due to this, Dr. Sebi shares his opinions on the matter. He was very upset about these errors and the use of artificial drugs by medical practitioners that are harmful to the human body.
So he told me that I could not eat meat any longer, no lamb. I could not drink any milk. And I abstained from all these things, and here I am now at 82. I'm happier than I've ever been in my life.
Dr. Sebi, a self-proclaimed healer named Alfredo Bowman, born in Honduras in 1933, said he could cure a litany of diseases using natural herbal remedies, despite not being an actual licensed doctor. His popularity went through the roof when he tried to detox Michael Jackson off painkillers.
The Mexican said to me, "You're dying." I said, "I know." "How do you know?" But my asthma and my diabetes, my impotence was kicking.
He was purportedly cured by a Mexican herbalist, and he then revived the notion by creating his own branded line of herbal products under Dr. Sebi's Cell Food. He was acquitted in 1987 on charges of practicing medicine without a license because of a lack of evidence. But the state of New York later sued him and won. He paid a $900 fine and was told to stop making claims about curing any specific disease.
Of course I did. I knew that I had sufficient evidence to prove my position.
He was then arrested in Honduras, where Sebi faced more legal issues with allegations of racketeering and spent a year in jail until his death from pneumonia in 2016. The central health philosophy of Sebi was that of alkalinity. The idea was that he could balance the acid that was coursing through the body by ingesting alkaline foods and herbs, those with a pH above 7, and that therefore he could challenge the natural buildup of mucus that he felt was the root cause of disease.
If we eat something that God didn't make, we are running the risk of disease. Then we're going to be angry. Like I were at only 30 years of age, I was extremely angry. I knew that the pH value had a lot to do with healing. And the herbalists then, like the herbalists today, are unaware that the pH factor has a lot to do with it.
Dr. Sebi strongly advocates for the use of natural, God-given herbs to cure diseases. And Dr. Bobby Price has also had similar thoughts.
So one of the things that I discovered, and I learned this in pharmacy school. Okay. 50%, almost half of, prescription drugs, they were made based on plant-based derivatives. Meaning you'll have a drug made and there'll be a plant out in nature that it based its chemical structure on to make the drug. Okay.
Dr. Bobby Price, a physiologist, a doctor of pharmacy, and plant-based nutritionist, went through a dramatic personal and professional transformation, transitioning from traditional medicine to holistic therapy.
Why wouldn't you just use the plant?
Yeah, exactly.
Well, the thing is, you can't patent plants. You can't patent nature. You understand that? So if you can't patent it, it means that any Joe Blow can come along and get soursop to get that mega dose of vitamin C to help with their cancer, to help with any type of infection.
Yep.
Initially involved in the pharmaceutical industry, Dr. Price prescribed drugs without considering their long-term requirements. His quest toward holistic health began in 2011 when he encountered several health conditions that standard treatment could not resolve. Desperate for a solution, he tried a plant-based diet for 21 days and had surprising results, including significant weight loss and the reversal of his long-term high blood pressure. Dr. Price traversed the world in search of alternative therapeutic approaches, studying with herbalists, shamans, and spiritual gurus. He became a licensed nutritionist and studied how fruits, vegetables, nuts, and seeds might cure and nourish the body.
We need fiber. Fiber is really good because it keeps us regular. It regulates our blood sugar, but it also is good because it feeds the good bacteria in our gut. It makes the fiber is very important. And again, you can only get fiber from fruits, vegetables, nuts, and seeds. You can't get them from dairy. You can't get them from meat. You definitely can't get them from processed foods. So
Dr. Price now promotes a plant-based lifestyle and holistic health techniques. He spreads his knowledge through one-on-one consultations, herbal detox programs, and his book, vegetation over medication. His approach stresses the body's ability to heal itself, questioning the traditional reliance on synthetic drugs. Dr. Price also discusses the broader topic of medical errors, emphasizing that they're frequently caused by the healthcare system's inherent risks and limits. He emphasizes that even when medical professionals strictly adhere to rules, patients may still experience negative effects, such as hospital-acquired infections. To protect themselves, Dr. Price recommends that patients prioritize self-education. Patients can make more informed decisions by researching and understanding their health conditions and treatment alternatives. For people who are unable to negotiate this intricacy on their own, he recommends consulting with a patient advocate who can conduct research and ask appropriate questions. Dr. Price's transformation and advocacy efforts highlight the benefits of plant-based nutrition and holistic health approaches. His message urges people to take responsibility for their health by educating themselves, making educated decisions, and turning to natural solutions. The food they suggest. Well, here's your favorite part. They promote the eating of specific plant-based foods, citing their health advantages and natural healing properties. Soursop, noni, sea moss, and ginger are some examples of these foods.
Not only is the fruit itself medicinal, but the leaves are also medicinal as well too. The leaves are really good for stomach pain, so they've been used in herbalism for hundreds of years for stomach issues, diarrhea, also for pain overall, anti-inflammatory, and it's also good for calming the nervous system.
And we would just like to take some time right now to just discuss some questions that we've had a lot of our viewers, people that call us, contact us. They know we're associated with you and they ask us a lot of questions. So we would like to just go ahead and cover some of those things. First question would be, what happened in Australia exactly? You are being called a quack, you are being called someone that's crazy out there. So what really is the truth? What happened? Why were you banned?
Dr. Barbara O'Neill, born on July 28, 1953, is an Australian advocate for alternative healthcare techniques that the scientific community has extensively condemned as harmful and unfounded. Despite reports of lacking recognized qualifications and failing nursing school, she's made claims at alternative medical organizations, health retreats, and Seventh-day Adventist churches. Following several complaints from the general public and health professionals, the New South Wales Healthcare Complaints Commission barred her from providing any health-related services in 2019. Investigations reported that O'Neill provided unsafe advice to vulnerable individuals, such as proposing bicarbonate of soda instead of chemotherapy for cancer treatment and unpasteurized goat's milk for infants. Her lack of training and failure to satisfy the standards expected of health professionals reportedly highlighted the risky nature of her advice. In this video, we'll look at reports of how Dr. Barbara O'Neill misled many people with her claims of a cancer-free life, emphasizing the dangers of unqualified health advice and the non-evidence-based medical procedures.
Drugs never heal. They never heal. And I know with my mum, when she first started to get her pains in her hand, she went to the doctor who gave her anti-inflammatories. And then as it got worse, then he put her on prednisones and cortisone.
Barbara O'Neill reportedly portrayed herself as a naturopath, nutritionist, and health educator since at least 2004, despite her lack of any relevant qualifications or training. Her husband, Michael O'Neill, is the founder of the Informed Medical Options Party, an anti-vaccination and anti-fluoride political group. Together, they ran the Misty Mountain Health Retreat near Kempsey, where clients were reportedly charged up to 8,800 Australian dollars per stay for services claiming to aid recovery from various health conditions, including heart disease, diabetes, chronic fatigue, and cancer. O'Neill also reportedly provided paid telephone consultations and presented her claims at alternative medicine organizations, wellness retreats, and Seventh-day Adventist churches.
Yes, it was a shock to us because it really had no foundation. In fact, when the complaint first came to us from the HCCC, we laughed. We thought, surely this is a joke.
Despite reports of no evidence to support her claims, O'Neill insisted her methods were valid. When questioned by the New South Wales Healthcare Complaints Commission, or HCCC, she could not provide any supporting evidence for her treatments. Videos of her presentations have been viewed over 700,000 times, and she has continued to conduct health retreats in New Zealand and the United States, even after being banned from doing so in Australia. Additionally, she's published several books on health and nutrition. Cancer treatment claims. O'Neill reportedly claims to have the ability to cure cancer. She promoted the notion that cancer is a fungus that can be treated with baking soda, and claimed that one doctor cured 90% of his cancer patients with baking soda injections. O'Neill also advised her clients to cure cancer by following a low-carbohydrate diet for 6 weeks. Reports are that her advice led to the death of a Cook Islands man with stage 4 cancer, who had declined medical intervention in favor of O'Neill's prescribed regimen of bicarbonate soda, lemon juice, and boiled water. Her supporters argue that he'd been in remission before his death. Anti-vaccination stance. Barbara O'Neill has reportedly been a strong opponent of vaccinations, stating that all vaccines are hazardous and cause a variety of health problems. In one of her popular YouTube videos, she reportedly proposed that children may be naturally vaccinated against tetanus by adopting healthy lifestyle habits, including drinking enough water, getting enough sleep, avoiding junk food, and participating in outdoor activities. O'Neill has reportedly opposed Australia's no jab, no pay policy, which links certain parental tax breaks to up-to-date child immunizations. This program seeks to boost immunization rates while protecting public health. Her association with the Informed Medical Options Party, a party known for its alternative medicine and anti-vaccination attitude, has reportedly sparked more condemnation from medical professionals and public health officials. These experts contend that O'Neill's anti-vaccination rhetoric undercuts attempts to preserve herd immunity and protect vulnerable people from preventable diseases. Despite overwhelming censure, O'Neill continues to preach her views about vaccines. Antibiotics and infant nutrition.
They're saying that I'm advocating that a woman go and put her baby on goat's milk if she can't breastfeed, and they're claiming that goat's milk might be lethal. We just laugh because babies have been fed goat's milk for thousands of years, so this is the sort of thing. So we didn't really take it seriously.
In terms of infant nutrition, O'Neill reportedly recommended alternatives to the formula for parents unable to breastfeed, including unpasteurized goat milk and mixtures of almond milk with dates or bananas. When presented with the National Health and Medical Research Council's infant feeding guidelines, O'Neill reportedly admitted she'd never read them and would refuse to do so. O'Neill had also discouraged the use of antibiotics, claiming they cause cancer. She reportedly advised pregnant women against taking antibiotics for strep B, stating that no baby has ever died from strep B contracted during birth. Reports from the Royal Australian and New Zealand College of Obstetricians and Gynecologists showed that 14% of newborns who contract early-onset strep B die, a risk significantly reduced by antibiotics. Investigations and prohibitions. The HCCC began investigating O'Neill after receiving several complaints between October 2018 and January 2019 from health practitioners and the public. The complaints mentioned her health advice, such as recommending bicarbonate soda for cancer treatment and unpasteurized goat milk for infants.
I think a nutritionist from Queensland was one of them, and she had looked obviously through my lectures and came up with something like the goat's milk.
The investigation reportedly revealed that O'Neill lacked any health-related qualifications and had failed to maintain records of her health advice as required by law. While reports claimed she had diplomas in naturopathy, nutrition, and dietetics from now-defunct organizations, the HCCC confirmed she had no verifiable health-related qualifications. O'Neill claimed she merely provided information rather than health advice and never claimed to cure cancer. On September 24, 2019, the HCCC banned O'Neill indefinitely from providing health services or education in any capacity, whether paid or unpaid. This ban included giving lectures, public speaking, or seeing clients. Despite this prohibition, O'Neill continued to advertise her services online and through the Misty Mountain Health Retreat. Ongoing activities and legal issues. Following the HCCC's decision, O'Neill reportedly attempted to rally support by launching an online petition calling for the reversal of her ban, with claims to be the victim of a Nazi-style propaganda campaign. In late 2019, the Australian Charities and Not-for-Profits Commission began investigating Misty Mountain Health Retreat for potential breaches of charity law. The retreat had received government grants and tax concessions under its health promotion charity status to provide diet, exercise, and health advice to marginalized communities. After being barred from providing health services in Australia, O'Neill continued her activities abroad. In October 2019, Cook Islands Health Secretary Josephine Herman reportedly raised concerns about O'Neill conducting health workshops in Rarotonga, leading to an investigation by the chief medical officer. Additionally, O'Neill scheduled wellness programs in the United States and continued to offer services to cancer patients. Well, that's it for today. Let us know what you think of Barbara O'Neill by sharing your views in the comment section below. For now, make sure that you like our video, subscribe to the channel to get updated, and don't forget to hit the bell icon to never miss an update. Thanks for watching the video. See you at the next one. Stay healthy.